All right, so let's start with this story, and it's the Western Cape where we begin. That province has seen a rise of 34% in COVID-19 infections week on week. Premier Alan Winde says the province has now entered the third wave. Of course, Gauteng is recording the bulk of new infections. The Free State, Northern Cape, Northwest, and now the Western Cape are also noting sharp increases in COVID numbers. Let's speak now to the head of health in the Western Cape, Dr. Cloete. Dr. Cloete, thank you so much for your time. What can you tell us about the latest COVID numbers in your province and how they fit in with the national picture?
Good evening, Sally, and good evening to the viewers. We can tell you, as the Premier has announced, that the number of active cases in the Western Cape has dramatically increased over the last week. We increased from 4,500 to about 6,000 active cases in 1 week. That's more than 38% increase. And that equates to about 500 to 600 new cases a day, if you average that out over a 7-day period. And also our hospitalizations, we now have gone up to about 50 new admissions a day. And that has resulted in us crossing over 1,000 people being admitted with COVID as of yesterday. And it is more than 500 cases in the private sector and about 450 in the public sector.
All right. So talk to us about the pressure points. Are there specific areas in the province that are under more strain than others?
We've been noticing the increase in cases over the last 4 weeks, and we've been watching it very closely. We've been seeing more and more clusters. And this is the pattern we saw in November, early November. That's why we've made the announcement today that we're entering a third wave, because it's exactly the pattern we saw in November when we were in a sharp incline. But all these clusters are now quite widespread across the province, Sally. And we've seen the pattern in the metro, Cape Town Metro, that it was mainly in more affluent areas, and these tests are coming positive in the private sector facilities from testing. And therefore also what we've seen is the sharp increase in admissions has been mainly in the private sector hospitals in the metro. If you look across the province, in the rural areas, there's been also clusters everywhere, but there's more evenly between private and public sector. And the capacity is still good in hospitals, but there's a sharp increase in admissions for COVID patients.
All right, so you're saying you've got about 1,000 COVID patients in hospitals across the province, pretty much evenly split between public and private, slightly more in private, 50 new admissions a day. With 50 new admissions a day, how long before your hospitals are going to be facing serious strain?
So, Sally, our lessons learned, and we do this together with our private sector colleagues, is that we have implemented a four-tiered trigger system. So we are on tier 1, and what it means is as we see sharp increase in cases, we start bringing some capacity online. If there's another tier of increase, we bring more capacity, another tier and another tier. So we are literally working from a yellow to an orange, from orange to light red and to a red system. Red is where the hospitals are under severe pressure. So there's sufficient capacity. It's about downscaling other activities and bringing field hospital beds online. So there's sufficient capacity both in public and private to systematically downscale other activities to make more place for COVID. That's why we're calling it, so that we can actually get stricter on gatherings, because any behavior change and strict on gatherings, and we're very strict on our recommendations, that we believe that we should have fewer people at gatherings, and that will help us to curb, so that we can continue to vaccinate and not spend absorb all our resources to be able to cope just with COVID in hospitals.
So, Keith, while we've been chatting, my colleague Hadi Jakos has just sent me the latest news from the NICD, and that is on the very latest in the new infections. So we remember, of course, yesterday it was some 8,800 new infections. Well, the latest news is that in the last 24 hours, as a country, we have 9,149 new cases. Does this suggest to you, looking nationally, that we are very close or perhaps already in a third wave as a country?
The NICD is the ones that must pronounce on the country picture.
Yeah.
And they've got very clear metrics on how they pronounce it. It has to be 30% of the total daily cases, 30% of the peak of the previous wave. So when we get to that figure, they will make that announcement. We are definitely suggesting with those figures that you've seen. I've also just seen them, Sally. You will see in that picture that there was 1,000 cases in the Western Cape compared to the 6,000 in Gauteng. So we are saying we're entering that third wave fast, and it's the inflection point of sharp increase in cases. We do believe that the country is entering a third wave as a collective, and we do believe stricter restrictions should be there on gatherings, because that's the one thing where we can break the transmission between people. It's in the gatherings. That's where the transmissions currently is being propagated.
We saw with the second wave that some of the provinces took provincial action. You say that gatherings need to be restricted really quickly. I mean, now we're looking at 2 days of infections, 8,000 on the one day, 9,000 on the other. In terms of that 30% of the last wave, that is averaging out to around 6,000 a day over a rolling average. So, as you say, we basically, as a country, are pretty much in the third wave or entering it. I think we may be days away. What other restrictions do you think we need? And I ask this because we know that with gatherings comes alcohol, and alcohol puts huge strain on our hospitals. Do you think we need more than just clamping down on gatherings?
What we've got, our public health experts have advised us on this, Sally. So we've taken, as I said, with those trigger systems. So in the early trigger now, the big issue is the transmission in gatherings. So we are making some very firm recommendations that came by our Premier to the National Control Council, the PCC as well, and that we believe that gatherings for indoors should now go down to 50, maximum of 50 people, outdoors 100 people, and 50% of all space, gathering space. And if people can do less than 50 indoors, that is preferable. Our personal advice to people is avoid any gathering. The second thing is, if you can work remotely, work remotely. The third thing is a restriction on movement of people. So the curfew has helped, but maybe a little bit tighter curfew. That is something that will help. But for now, it is very much a concentration on gatherings and movement. As it goes a little bit further, Sally, and more of the capacity gets absorbed, I would imagine Gauteng would be much closer to that than us. That happened to us in December. Gauteng benefited from the restrictions that came in on the 28th of December. But I would imagine that Gauteng, when the capacity of the hospital starts getting threatened, and that's for us still a way off, that's when alcohol starts playing a role, because then it is you're competing for the same capacity. We're not quite there yet. I'm not sure about the rest of the country, but we're not quite there in that. So we regard alcohol as a late restriction, not an early restriction.
Right. Update us on how vaccinations are going in the Western Cape.
Sally, we have taken a very deliberate stance in the Western Cape. I think I've previously explained it. We are into we've just completed the third week. We're into the fourth week. In the first week, our target was to get 10,000 vaccinations. We were testing the systems. We achieved 10,300 in the first week. Second week, we went to 16,000, a target. We achieved 60,000. We achieved 66,000 in the second week. So our target is being now for this week is we have the capacity. So we have gone into this week from 8 sites in the first week, and in this week, we currently have 208 sites, 180 in the public sector, and about 25 sites in private sector. We have the capacity to do 120,000 or more vaccines per week. That is the capacity to do 24,000 vaccines a day. The issue that we're sitting with is we have been given doses to only do 70,000 this week. So our capacity currently exceeds the number of doses available to us. And we all understand that the big reason why the doses has been limited is that Pfizer was never supposed to be the only dose that we use. It's the Johnson & Johnson that is that dose. If that dose is available to us, we can scale to 24,000 or even more doses per day in the Western Cape. But we've geared. And if you track the national dashboard, you'll see that we are now, like yesterday, we did 16,000. I think that was about 25% of all the vaccines done in the country.
Well, thank you so much for that update, and good luck to your province as you move into that third wave. That was Keith Cloete. He is the head of health in the Western Cape. Now,